Welcome to our quick guide on low blood counts. In this video, you will learn about different kinds of low blood counts and tips on how to cope. Coping with the symptoms and side effects of treatment can be overwhelming. Keep in mind that there are steps you can take or choices you can make to help make the treatment a little easier. Watch our quick guide to metastatic breast cancer symptoms and side effects for general tips on coping with metastatic breast cancer. Chemotherapy can reduce or lower your levels of white blood cells, red blood cells, and platelets. When you have low white blood cell levels, this is called neutropenia. It puts you at a higher risk for infection. Your doctor may recommend growth factors, such as filgrastim, Neupogen, and its biosimilars like Granix and Zarxio, or pegfilgrastim, Neulasta, and its biosimilars like Fulphila, to help prevent neutropenia. These medicines promote white blood cell growth. If you have low white blood cell levels, talk to your healthcare team about steps you can take to prevent infections. You can also try these helpful tips to prevent infection. Wash your hands frequently and thoroughly, especially before cooking and eating. Take at least 15 seconds to wash your hands with soap and warm water. Use hand sanitizer when soap and water aren't available. Moisturize as needed. If your healthcare team tells you to avoid people who are sick, stay away from large crowds, avoid anyone, especially young kids with symptoms of cold or flu, avoid children and adults who have gotten live vaccines, such as chickenpox, nasal flu spray, or polio, in the past 2 weeks. If you cut yourself, clean it well, and apply an antiseptic. Wash fruits and vegetables well before eating. Avoid touching or eating raw or undercooked meat, chicken, eggs, or seafood. Ask your doctor if you need medication to increase your white blood cells. Ask your healthcare team about when to get vaccines for flu, shingles, and pneumonia, for example, before you start treatments. Also, ask about caring for pets during periods where your white blood cell count is low. When you have low red blood cell levels, this is called anemia. You may feel tired, short of breath, or dizzy. Sometimes a blood transfusion can help restore iron and ease symptoms. If your blood counts continue to be low after blood transfusions, your doctor may prescribe a growth factor such as epoetin alpha, Procrit, erythropoietin, Epigen, or darbepoetin, Aranesp. These medicines help stimulate the production of red blood cells. To cope with the side effects of anemia, make sure to get plenty of rest. Ask your family and friends for help with tasks if you're feeling tired or when your energy is low. Eat a healthy diet and drink lots of fluids. Ask your doctor or nurse about iron-rich foods that are important for you to eat if you have anemia. Stand up slowly. Anemia can cause you to feel dizzy when you rise quickly after lying or sitting. Ask your doctor if you need medication or a transfusion to increase your red blood cells. If you're having chemo treatments, let your healthcare team know right away if you develop a fever, sore throat, burning with urination, rash, or fatigue that gets worse. Platelets are blood cells that help control bleeding. If cancer treatment lowers the number of platelets in your body, this is called thrombocytopenia. Low platelets can cause bruising, tiny red dots in your skin called petechia, or bleeding from any part of your body. Many medications can increase your risk of bleeding. These include aspirin, over-the-counter pain relievers, and some herbal supplements. Tell your doctor if you take these or any other non-prescription medications. If your platelet counts become very low, you may need a platelet transfusion or a delay in your chemotherapy treatment to allow time for your blood counts to further recover. Here are some tips to help you prevent bleeding. Use a soft toothbrush, avoid toothpicks, and ask your healthcare team about dental floss. Blow your nose gently. Use an electric shaver rather than a razor. Do not cut your cuticles, push them back instead. Try to avoid injury. Be careful when using sharp objects. Do not participate in contact sports. Apply firm pressure to any cuts. Do not use suppositories, enemas, or rectal thermometers. Avoid constipation. Ask your healthcare team if you should use a stool softener. Also ask them about sexual intercourse if your platelets are low. More information on cancer treatment side effects can be found at www.cancersupportcommunity.org/side effects. Return to our metastatic breast cancer quick guides to find tips on how to manage other side effects of metastatic breast cancer.